Welcome to Doctors at Work. My name is Matt Daniel, and this podcast is about doctors' careers. It's part of my mission to help doctors create successful and meaningful careers. Today, we're having a discussion about general practice. Now, Ranj tells me that general practice is an exciting specialty with a wide variety of conditions and interactions. Good communication skills and teamwork are essential, as is an ability to manage uncertainty. We discussed the many different ways that GPs can work, including portfolio careers. And I love the way his practice has created structures that enable staff to connect and get support from each other. Welcome, Ranj. Tell me a little bit about yourself.
Hi, Matt. Thank you for having me on. So I'm a GP. I've been a GP now for the past 11 years. I'm a GP partner in a practice with three other partners. And I, as well as being a GP partner, I'm a medical student tutor, FY2 and a GP trainer, GP registrar trainer. And I also do some other areas of interest like lifestyle medicine, minor surgery, and dermatology.
Thank you. And the topic for us today is about a career in general practice. So tell me, what's general practice like?
General practice is very interesting. I think for me the key things I really enjoy about it are the variety, the continuity of care that you get in general practice, and also the main thing I like about general practice is kind of going on from continuity, that relationship building. So you build relationships with your patients, because you might see them from the time they're born all the way throughout their lives, and I think that's the really interesting part for me.
And how did you get interested in general practice initially?
Yeah, I mean, it's been an interesting journey for me, because after medical school, I thought I wanted to go into orthopedics. So I did train as an orthopedic doctor for a couple of years, but I found a couple of things. A lot of it was to do with work-life balance, and so that kind of took me to thinking about other areas and other careers. And I think again with general practice, it was one, the variety, secondly the sort of that continuity of care, and just again being able to control kind of my plan for my future, and kind of the variety of work that I wanted to do. I think that those are really important aspects. So and then kind of getting into general practice, I found that I can do that, and it's been a really good experience ever since. So I have a number of different roles, as I mentioned earlier, and it kind of varies throughout my working week, so it keeps it really interesting for me.
I wonder if we could maybe kind of start somebody's career journey from the beginning. So there's somebody who may be an F1 or F2 listening and contemplating that. So how does one get into general practice training?
So obviously, whilst you're training during your foundation training, obviously you have to apply for general practice training, and obviously we have FY2s that rotate through general practice, and like I said, I'm a foundation trainer, and I always think it's nice to get that general practice rotation in foundation years, because I found a lot of trainees actually who've come through who weren't thinking about general practice actually start to think about it, because they get to really enjoy it. And it's a training program like any other like medical or surgical training programs that they have to apply for, and go through the interview process for general practice training. And the general practice training is a 3-year training program.
And what kind of skills does one need in order to get into general practice?
Obviously, I think the biggest skill is communication, being able to talk to people, and kind of that building a rapport, building a relationship. I think that's vital in general practice. I always talk to trainees when we're doing tutorials and things, especially when they first come into their FY2 rotation. I always say in general practice, you have to kind of get comfortable with uncertainty. Um, we, we see a lot of complex patients, and everybody that kind of comes through the door, you're always having to think about what could potentially be going on with these patients, and you have to be able to take certain certain degree of uncertainty into account. You have to be comfortable with the decisions that you make. So, but I think it's a very kind of interesting and challenging part of general practice. It also makes it really really satisfying and fulfilling when you're doing the job.
So I'm wondering, I mean, what kind of a person is comfortable, or how would a foundation doctor know that this is for them or that it's not for them, or how do you develop this ability to manage uncertainty?
It's a really good question. I think it comes with experience, and I think it also comes with having good support and training from the beginning, and that's again something that we really focus on in our practice as a training practice. Again, something I tell my FY2 trainees is that you'll hear this is a learning experience for you. I always like to kind of make that differentiation between a foundation trainee and a GP trainee, because obviously they're learning. Mm-hmm. Their training is different. They're training to become GPs, whereas the foundation trainees are kind of building their knowledge and expertise from a very early level. So I think that's a big part of where it comes from. It comes from kind of the groundwork that you build in, and then you're building your experience on top of that. So, but having that good support structure around you, your supervisor, knowing who to go to, because in the early stages, foundation training, they're going to need a lot of support. And we ensure that we've got that support kind of built in, so that they can debrief after each patient. They can come to us for support with if they're stuck or they need some further guidance. So I think having that in the beginning is really important. And then it's one of those things kind of we all still deal with it. Yourself, you probably deal with a lot of uncertainty day to day, and we still do. And also having support kind of ongoing doesn't mean like when you finished your GP training and you're a GP that you don't need any support anymore. We've kind of we've always had this ethos within our practice of we're all here to support one another. So we kind of make sure that we can talk to one another. We've always had this kind of open door policy at work, where we can talk to one another about clinical cases, or even if we just need some some support for ourselves. A really funny one is myself and one of my partners. Our rooms are at the end of the corridor, and they're kind of opposite one another. And in between clinics, we leave our doors open so we can just chat in between, and we find that's really helpful, because we could just share comments and ask each other questions. But it just kind of illustrates that we have this kind of very open policy that we can ask. No question's a silly question. We can ask any questions, and I think that does help to kind of support you in this kind of uncertain environment that we work in.
I'm interested in how you talked about supporting and connecting with each other, because my impression would be that being a GP may be quite lonely, because it's just you and the patient, and it's perhaps
Sure.
a very different setup to somebody who is 24/7 as part of the multidisciplinary team.
Sure.
So I can see how those connections are really important. So, and that idea that there's a physical proximity, that's really important. I mean, what else have you seen that works well to help create those kind of connections with each other in that support mechanism?
Yeah, absolutely. I mean, I was lucky that from the beginning when I trained, because this was my actual training practice as a GP trainer, and I've been here ever since. And I think that's one of the things that my trainer and the partners who were there before me kind of instilled into me, and that kind of ethos we've tried to maintain within the practice of kind of, it's an open, everyone's door's always open. You can always ask a question. Nobody nobody knows kind of more than anybody else. So I think that's kind of always been a kind of a key thing for me. So I think that works in kind of having this supporting environment. Other things that have worked, again, we have a regular clinical meeting kind of in the middle of the day, where it's only kind of half an hour long, but anybody can bring clinical cases or things they need to discuss, and we just sit in one of our rooms and we just have a kind of an open discussion. So that works really well. And even and then we have certain other sort of meetings during during the week or the month, where other clinical staff like nurses or even sort of whole team admin team meetings, we can get together and we can have discussions. But like I said, day to day, we are very open, and that's the kind of environment that we like to encourage, is making sure that we can all talk to each other. I think something that's really helped as well is we have a kind of a morning huddle. So 8:15 in the morning, we all meet in reception, and the duty doctor for the day just does a very brief overview of who's here, anybody missing, does that mean if somebody is off sick, do we need to cover? Just little things like that. What kind of meetings are going on in the day? Is there anything else that's happening? And it just kind of brings everyone together.
So it sounds like that what you created is actually very similar to model to what many of us in hospital work, which is that you might meet together in the morning, or you see each other at lunchtime, and and every now and then you have an MDT slash discussion slash
Yes.
cooler conversation, an opportunity to discuss the difficult challenges that we might face as individuals, as well as the patients.
Yeah, I think we've tried to, because you're absolutely right. It can be a very lonely environment if you're in your office all day. You've done your morning clinic, then you do your admin in the day, and you go on a couple of home visits, and then you do your afternoon clinic. You can go a whole day without seeing anybody, talking to anybody. And if you did that consistently, it does start to become very isolated. And sometimes, and it still can happen on occasions where, like, you've just been so busy that you've just got through your day, and then before you know it, it's the next day. But we've tried to kind of safeguard against that, to try and make sure that that's not happening.
It's interesting because in many ways it's actually, if I think of me, when I do clinic, well, I go to clinic and I just sit in clinic and I see patients, and it's just me. I don't. Sometimes I have a nurse that brings patients in, but so it's perhaps, maybe it's not as different as I thought that it might be, particularly sort of with all of those common junctions. I'm interested in how different practices work and what the career opportunities are. Because I know that, you said you're a GP partner, you've outlined the philosophy of your practice, but there'll be some people will be salaried GPs, or, the retainer scheme, although I think that's finishing. So you can tell me about that. Or some people will work for consortia, some people work for private companies. So, when you qualify as a GP, there's probably quite an exciting opportunity, because there's all of these different ways that you can have a career. Maybe with me as an ENT surgeon, well, I'm going to work in a hospital, or I'm going to work in a hospital. That's it. I can work in a big hospital or a small hospital. That's my choice. It sounds like in general practice, you're very lucky, because there's quite a wide range of choices as to where a newly qualified GP can go.
Yeah, you're absolutely right, and there are so many different avenues to explore, and I think, again, that's one of the reasons why I was attracted to general practice, because I like to have kind of variety, and yeah, you're right. I mean, I after I qualified as a GP, my training practice took me on as a salaried GP part-time. It was mainly because I wanted to try salaried GP, but I also wanted to see what locuming was like. But I quickly found that actually locuming was quite isolating, and whereas being part of a team, and being going to a regular practice, with what felt like my own team around me, was kind of more of what I wanted, and it was kind of also because of that continuity of care and being able to build relationships, which was really important to me. Yeah, I mean, for me personally, I didn't particularly like locuming. Like I said, it was quite isolating because I was working through a locum agency. I mean, there are different types of locums. You can have long-term locums when you're doing, a 6-month or a maternity cover or something like that, where, you can build that sort of continuity. But when you're working for an agency, you could be going to one surgery in the morning, a different surgery in the afternoon. Places you've probably never been before, people you've never met before. You don't know how different things work in the practice. So yeah, it wasn't particularly for me that route, but it might be for other people. That's why being able to try these different things is quite a luxury actually in general practice.
Mm-hmm. So locuming is that you go and you do a session and then you disappear. So I mean, what are the advantages of doing locums?
It's the advantages are, again, if you like having that sort of variety where it's kind of, you don't mind sort of working in different places. It's and kind of the type of work you tend to get is not so much the complex patients you might get. It's more kind of same day acute stuff that you may be seeing. So if you like that kind of work, and also it doesn't come with the responsibility of all the admin work and practice related work that you might have as either especially as a partner, but as a salaried GP, because when you're a salaried GP, you are more part of the practice. So depending on what kind of relationship you have with the partners and the practice, you might be involved in a lot more of the sort of the day-to-day work, sort of cloth work or other work that might be available, like some of our salaried doctors do, depending on their interests, coil and implant clinics, minor surgery clinics, women's health, other things like that.
What's the difference between a salaried doctor and a GP partner?
So salaried GPs kind of work for the practice, so they're employed by the practice. Obviously, a partner is a person who owns the partnership of kind of to supply that GMS contract.
Mm-hmm. So that's the thing that always appealed to me is the idea of being a partner, because one of the things that maybe in hospital I always think, well, if I want to buy some different paper, that's like a 6-month process of procurement. I have to do an incident form, put a business case together, demonstrate a need, do a risk assessment, and then I get to spend £20. And
Yes.
I've always imagined, as a GP partner, that must be fantastic, because if you say our practice needs this, you just make a decision and you make it happen. So I love the freedom that brings.
Yeah, I think you're right. Absolutely. I think that's what appealed to me as well, is having that autonomy of being able to make decisions. Doesn't always mean they get made faster, because obviously there are still sort of things you have to kind of navigate and you have to do it within certain rules, like you say. But it does still come with that level of autonomy where you can kind of make decisions. We, as personal experience from our practice, we've always tried to be kind of a leading practice. So whenever things kind of are coming into kind of into trend, we like to try and kind of move things along quite quickly. So as an example, things like sort of developing a triage system was something that we implemented quite early. And that's kind of become quite the norm now for practices to kind of triage the sort of acute patients and things like that. So
What's the downside of being a GP partner?
There's a lot of obviously extra work in the background, a lot of admin work. Obviously, there's so many more pressures now within general practice, and we see a lot of strains on kind of costs and things as well. So it's something that we're always having to factor in There's general practice is changing. The landscape of general practice is changing now with the with PCNs coming in, primary care networks, where obviously there's a lot more influence now by the primary care network on how we deliver our services and how we integrate primary care staff with our staff as well. So there's a lot to kind of factor in.
Mm-hmm. Mm-hmm. And what about the other models? We talked about you can be a locum, you can be salaried, you can be partner, but what about online company, private GP services, private companies that run services? Tell me about those.
Yeah, I mean, I think it stemmed from the fact that obviously there's so much demand for health services now, and especially general practices. That first port of call is always the GP, and I think it's just trying to find new ways of being able to access general practice services, and obviously through the pandemic, obviously we had to adapt some of the ways that we were working. Obviously initially there was very little to no face-to-face. A lot of it was telephone work, a lot of video calling, but we quite quickly moved when it was safe to back to pretty much fully face-to-face. But there are benefits in some circumstances. Me personally, I've always been the sort of person that's preferred face-to-face. I always think that patient-doctor interaction should be on a face-to-face level. It doesn't mean that certain things don't work well. I mean, like teledermatology is a brilliant example of something that can be done through pictures and videos and things. Well, maybe not so much video, but definitely pictures do work really well, and especially with especially if you can do dermoscopy as well, then that's and there are teledermatology services between primary and secondary care, which is really, really good. It's really, really helped the system. In terms of kind of remote sort of private companies doing sort of remote GP services, again, it's there and it does work, but there are obviously some downsides to it in that I think it works mainly more for acute problems. So if someone's got a chest infection, water infection, something like that, then it's an easy access way to get some antibiotics if it's needed. Again, it's that thing of not being able to clinically assess the patient that that does create the difficulty. But if it helps somebody get quick access where they can't get it in primary care, then hopefully it's helped them.
I hope you're enjoying the show. Please click subscribe so you'll be notified when new episodes become available. This podcast is part of my mission to help doctors create successful and meaningful careers. You can be part of that mission too by forwarding this show to one person who you think might benefit from listening. Thank you. Now on with the show. It's interesting. If I looked at it, I thought I had the chest infection, and the limitations were that the app, I can't remember what the app was, but says we'd need to see you for this and this, and by the time that I looked through the list, I kind of thought, okay, so what could you offer me remotely, sort of in that sense, yeah. As opposed to my normal GP practice, where probably same as yours, everything's face to face, and sometimes I might not want it face to face, but it is. So it's quite interesting, and I think that there's quite a lot of new ways of working. Sort of again, if I think of my experience, both as a patient, as a secondary care clinicians, sort of in terms of the roles of nurses, the roles of allied health professional, sort of pharmacists, it sounds like there's quite an exciting landscape when there's lots and lots of innovation that's happening in terms of how care is delivered.
Yeah, absolutely. You're right. And that's what I mentioned earlier about primary care networks, and all of these new roles now are filtering into general practice. And now via the primary care networks, we have clinical pharmacists, nurse practitioners, paramedics, health coaches, social prescribers, all part of the primary care team. And so, like I said, it's a developing landscape, and it's how we kind of integrate all of these different people into practice. And we've had some really good experiences so far. We have a couple of paramedics working with us who provide brilliant acute services. So they see a lot of the day-to-day acute patients. It basically means freeing up time for ourselves and salaried GPs to see some of the more complex problems. So it's how we use these roles kind of in the most beneficial way.
And it sounds like a really exciting space to be. If you're a GP who loves innovation, who loves thinking outside the box, who has different perspective, it sounds like a great place to be, for somebody who's really keen on innovating. Yeah. So I suppose, one of the things that I wonder if, and this isn't just general practice, maybe this is all of us, if all of us as doctors give some of the straightforward routine tasks to non-doctors, then what we're left with is the complex stuff. Now, you might argue that, well, that's what we're there for. I suppose that the flip side is are we set to work like that? So, maybe if I think that if you have 10 minutes appointment, then the assumption is that 9 out of 10 are going to be kids with ear infections that just need some antibiotics, then, that's fine. But if you have 10-minute appointments and 9 out of 10 are people with multiple comorbidities, with multiple problems that have just been discharged from hospital, then you kind of think, well, hold on a second, this is taking a lot longer than a child with a sore throat, or, somebody with a toenail rash.
Yeah, you're right. You're absolutely right. And we did have to, and we have as well, looked at the system because yes, there is. So we are seeing a lot more of the chronic, more complex cases. So actually, our routine appointments now are 15 minutes. So we've adapted that, but we still have same day acute appointments because you do need to keep that balance. If we're all seeing just chronic, complex patients all day, that's quickly going to lead to sort of stress and burnout on our. So there has to be a bit of a balance, I think.
So it sounds like your practice is very forward thinking. I'm interested in sort of, you mentioned that you do a bit of skin surgery and sort of and you do coaching, and I'm interested in sort of how did you go from being a GP that's a standard GP? How did you branch out into these things?
I think it's just always, for me, I'm always on this journey of kind of wanting to learn more and being able. It kind of stems from being able to do more for my patients. So obviously dermatology was something we hardly ever get taught in medical school, and then in your early years in training, and obviously in general practice we see so much dermatology. I mean, same with orthopedics and musculoskeletal problems. Luckily, obviously, I had a couple of years of extra training in orthopedics, which has helped. So I do, sort of a lot of joint injections and things in practice. But dermatology was something I became really interested in because you see so many different things, and being able to treat those things yourself without always having to refer to secondary care, and especially obviously now we know how overwhelmed dermatology services can be, is really helpful. So I did the Cardiff Diploma in dermatology, and then I did the Dermoscopy course as well. So it's nice to be able to sort of see patients with skin problems, manage a majority of skin problems myself. Look at skin lesions as well, being able to reassure a lot of patients who have benign skin lesions, and hopefully take some pressure off secondary care for not referring in things that don't need to be seen. Although a lot, there are these, I mentioned teledermatology, we have advice and guidance now from dermatology, so there's really good support now from secondary care dermatology. But what's also been nice about doing the dermatology myself is that within the practice, again, I'm able to support my colleagues. So when they have patients that they're not sure about with skin related issues, they can bring them to me. And likewise, it's nice working in the practice where everybody has different interests, which, so I can go to one of my colleagues who's got an interest in women's health, or a colleague who's got an interest in diabetes. So again, it's that kind of that supportive, collaborative working, which I think, we've kind of fostered in our practice.
So that, the career aspect of it. So, you identify an interest or a need, and a willingness to self-develop, and then, you do some training and,
Yeah.
you skill yourself, and then now you have the skills to deliver that. And then how do you incorporate that then into your GP work?
So I mean, so the dermatology, that's obviously been incorporated, quite easily in terms of what I can help with day to day and what patients I can see and manage. The lifestyle medicine has been a really interesting journey, and again, a lot of that for me has stemmed from the kind of the feeling of there must be so much more we can do for patients. From a root cause level, I think I've always had that feeling of we're a little bit too reactive, kind of waiting until somebody's either developed diabetes or had a heart attack or a stroke, and then we're really trying to push lifestyle. Well, actually, we should be doing that a lot earlier on, and it kind of got me down the lines of thinking, well, if what we currently do when we're talking to patients and telling them, we should be doing this, these are the things we should be eating, that doesn't really work for most people. Just telling somebody you should be doing something doesn't make them change those behaviors, which is why I kind of developed this interest in coaching, because it's all about helping people, empowering people to develop those behavior changes, those habits for themselves, seeing why it's important for themselves in order to develop those changes. That's been a bit harder to incorporate into general practice. Again, biggest reason is obviously not having significant amount of time with patients to incorporate this into into your consultations, because it's having deep discussions with people. But you can do it. So you can start to do small amounts of it with patients within conversations. So that's something I have started to integrate now, and hopefully, like we said as well, with the PCNs, bringing in health coaches. So there are health coaches who can then kind of expand on that for us. So if we can start the conversations, then hopefully that's something that we can work collaboratively together with the health coaches.
So if I think again, the career, sort of somebody listening and thinking, okay, what's my career as a GP going to be like? So you can do all of these things that interest you, and you identify a need, you have the skills, and then some of that very nicely just fits into your everyday general practice work. But there will be other bits that don't neatly fit into your general practice work, and it's then a question of creating opportunities where you can be doing more of those kind of things, not as a GP doing GP work, but as a GP doing non-GP work. Is that sort of a fair summary?
Yeah, absolutely. Yeah, I mean, yeah, you're absolutely right. So there's a lot, like you say, does fit into general practice, but then there's a lot if you do develop the specialist skills. So obviously there are GPs now with extended roles in cardiology, dermatology, and then you can work outside of the general practice within community clinics, like community dermatology clinics or community cardiology clinics, and that's in closer collaboration with secondary care. So that there are a lot of opportunities, and obviously there is the private sector as well that you can take a special interest skills into.
The other thing that I wonder if I could just talk a little bit about is the leadership opportunities, because I think one of the things that I see where I am, our integrated care system is kind of burgeoning and exploding, and there are lots and lots of GPs that I see that are working in senior leadership role doing really, really exciting stuff. And I suppose the other thing also for us is the medical school, because I think the medical school is really interested in in having GPs, much more than having ENT surgeons. Yeah, because because like I know about this much of medicine, so I think they're much more interested in having GPs than they are in having an ENT surgeon.
Yeah, I mean, again, yes, it's there are loads of opportunities for GPs to get involved, especially um, from the ICB point of view. There's lots of GPs that do work within the ICBs, or the old CCGs, if you like. So yeah, there's a lot of potential, and obviously, I think knowing sort of the primary care side of things, understanding how primary care works, and how it integrates with secondary care is very useful if you're going into those kinds of leadership roles. And obviously, if kind of leadership in that sense, is something that interests you, then there are plenty of opportunities for it.
What kind of attributes do you need to be a really good GP?
What kind of attributes? I think from kind of my perspective, I think it's always it's always good to have patience. So being kind of calm and patient is always helpful. Um, being able to, again, like we said earlier, sort of communication is really important. Being able to listen. Listening is probably the most important aspect. So I want to talk about what listening is: active listening, and that's where you really start to build rapport with patients. When patients feel that they're actually being heard, that makes a huge difference. And that's where you're going to be able to do your best work as well as a clinician. Once you actually hear what the problem is, once you understand, the sort of the patient on a more holistic sense, so not just the problem that's facing you, but actually what's happening for that patient in their lives, and you can understand a bit more and start to think about how to help patients. So yeah, so being a good active listener, being patient and calm under pressure, because we're all working under pressure, and just being able to sort of be calm and kind of think and focus clearly under pressure is really helpful. Again, like I said, being able to work in a team, although a lot of the work can be isolated, but being able to work as a team and being able to kind of be humble and know when you need some support and need some guidance. It's completely okay. Me as a GP partner of, I can't remember now, 8 or 9 years, I'm really happy to hold my hand up and ask a colleague, or even when I'm with a trainee and we're doing, I'm sort of observing a trainee doing a joint consultation. I thought, I might say at the end, I forgot about that. That's something that was really interesting that came up. So you're just being able to, say that was a learning need for me, or I don't quite know this, and do you mind helping me with this? Yeah, I think those are really important attributes to have.
What are some of the challenging aspects of the job?
Yeah, I think the biggest challenges is sort of the work, the pressure, the workload pressure. That's probably the biggest one. Day to day, this as a GP in itself, sort of the pressure of clinics and the amount of demand there is for general practice services, but also the complexity, the increasing complexity of patient need now does put a lot of demand on you and a lot of sort of stress and strain on you. So that's quite a big challenge. And again, like I said, we've tried to put things in to try and reduce as much of that as possible. Other challenges as a partner, there's obviously the running the sort of the business aspect of general practice is getting a lot tougher as well. Increasing strains on costs and things like that. And also hiring staff. There is a big staff turnover because of things like the pressures of working So sometimes you do lose staff, and trying to get new staff can be a difficult one as well. So as a partner there, those are some big challenges.
And what are the best aspects of the job?
For me, it is the teamwork. The team I work with is amazing, and like I said, that's hopefully a culture within our practice that we're going to continue and will always be part of the practice. So yeah, the teamwork, obviously the patients, even though they might be complex, even though they might be challenging, being able to help somebody is always rewarding. So I love that aspect of the job. And it's the variety and the relationships that you build. You see so many different things, and that's what keeps it interesting. You might have a throat infection, one patient, and an MI walk in the next one. So it really does kind of keep you on your toes. So this is, so that's something that you kind of thrive in. I think that's a nice pressure to have. And like I said, the sort of the relationships you build, the continuity of care, patients that you see over time, how they've changed, especially when you're working with somebody and you're trying to implement new changes, and you see, the diabetic who's completely reversed their diabetes and all the lifestyle changes that they've made, and they're feeling so much better now. That those are really, really rewarding aspects of the job.
And then maybe my final question, what would be your top tips for somebody considering general practice, or for doctors at work in general?
Okay, top tips would be, if you're considering general practice, I think it is an amazing career, a really fulfilling career. It is about, if you really do like that, the challenge of some uncertainty and also the variety of work, I think that's it's kind of a really good career. What else was I going to say? Other top tips would be, obviously the important thing is to always be sort of kind of kind to yourself and compassionate with yourself. It's a career that can take its toll, or whichever form of medicine you kind of go into. So it's always having that awareness of yourself and being able to know when you might be under a bit of stress and strain, and being able to try and seek advice and help where you need it. I think that's always an important part, whichever career path you go down. So I think that's really important, and that's for all doctors. There is a lot of stress and strain. There is a lot of demand on all parts of the system, so we need to be able to look after ourselves. And that's another area where it's okay to reach out for help. And I think that's an important message that a lot of, to send out to everybody, that it's okay to ask for help. We've all needed it at some point, and there are people out there to help and support you. Other top tips is obviously enjoy the career that you're going into, and there's no reason why you can't explore different careers, like I did, to find out what actually fit for me, what actually was really gave me the sort of the motivation and the passion to kind of deliver the kind of care that I wanted, that work that kind of fit with my values in serving people.
Wonderful. Thank you very much, Ranj.
Brilliant. Thank you, Matt. Thanks for having me.